Do you have anyone who has not registered yet?
For the hold up, we'll have to wait for the sign up of the temperature. We'll check it out to different demands. We feel to that therefore has to continue without our colleagues being able to follow. So that's the last thing I want to do. So we'll wait for them. Sorry.
that we are having for this year's Regional Adolescent Health Indaba, which is running from tomorrow to Friday. The first one was yesterday around HIV prevention, which was led by UNAID. In here, that we're part of that event. So for this particular one, we are also aligning it to what is happening, the UHC Day that is coming up in December. So what we're doing here, we are also carrying that conversation along. So a reminder to everybody joining for the first time that this is not one of the talk shops where we come, we talk, we go, we pack everything up. So we are hoping to identify and work with young people that are willing to work with us beyond this particular conversation. So there'll be a number of action points. There's some issues that we're taking immediately from here to the Regional Adolescent Health Indaba conversation tomorrow. So some of you in here may be identified to actually participate in that conversation on the panel, either as a panelist, and some of them also will be joining the side events around UHC. So if, just in case, we may not understand abbreviation UHC or universal health coverage itself as a whole, this is the opportunity for us to learn and grasp what we are discussing. This year's event, the Rahai, we have tried by all means to learn from the past and ensure that it's a lot hands-on, and there's a lot of action that young people are taking beyond this conversation. Just like I said yesterday, everything coming from this conversation is also informing our position paper. The position paper is what young people then use for conversations in decision-making processes. For those from Zambia, and I think a few other countries around Africa, next year, we'll be doing our funding request to the Global Fund. And the Global Fund is one of the major partners that is supporting health. For the Global Fund is HIV, TB, and malaria. And I think in the recent past, they're getting a lot of SRH in there. So whatever we're doing here is informing that position paper. It's going to inform our participation moving forward. So I have heard a lot of young people complain about the lack of meaningful youth engagement. This is meaningful youth engagement. It starts from here. This is you as a voice to conversations that find their way into policy. Okay, so let's take this conversation serious. Let's not take it lightly. It's not just one of those conversations. And in this room, I want to believe all of you are invited to the Rahai, right? So if there's anybody who hasn't received formal invitation, please see Natasha. Natasha? Yes, Natasha sitting in the back. If you don't have a formal invitation to the Rahai, see Natasha to see how she can be able to facilitate that. Because the idea is that you guys are taking this conversation forward. And I'm sure you know that there are lots of young people out there. They are in millions, but you have been selected to be part of this conversation. So you are representing a number of young people in your communities, a number of young people in your country. We had thousands of young people applying to attend the Rahai, but we could only accommodate a total of 600. So you guys are ambassadors. They're representing a lot of people. When you speak, you're speaking on behalf of your community. When you speak, you're speaking on behalf of your country. So just remember that. Even the way you carry yourself over this particular, during the period of this event, and the Rahai, as well as beyond. So once again, thank you so much. You are welcome. I wish you the very best, and I encourage you to participate fully and freely. This is a super safe space. If it's something you don't know, feel free to ask the questions. Feel free to ask further for you to learn and understand. I've just told you these guys came a long way. Okay? Weismark came from the US, Laura from the UK. It takes hours. It's over 10 hours in the air to come here and participate. So we have them over the next few days. Super excited that they're here. So I hope you guys can maximize this opportunity. Thank you so much once again.
All right. Thank you so much, Sibu, for the warm welcome, and really very excited to see all of you here and some of you who are here last year. Um, before we start, I just want to highlight a point that um, Sibu just made, which is that meaningful engagement is what this session is about with young people. It's not coverage about how do we improve and ensure that everybody in this world, where they live, who they are, have access to basic essential health needs services that they need. And the best way to do that is to make sure that we hear from the people who are most in need for those essential services. Because what we do know is that oftentimes policies do exist, governments do implement them, but they implement them for the greater majority, and then they leave out certain pockets or populations that are either poor or that are disadvantaged in one way or another. They never pay attention to their needs. What this conversation we're going to have today is about is to make sure that all of us do our part in our power to raise the voices, especially of young people. Young people and the elderly are always left out. They're always not at the table. So this conversation today is about learning from you, we're learning from each other about how we can go about changing that. The idea that somehow young people don't know anything, and so we cannot consult, we don't need to talk to them, we don't need to consult with them. The idea that for young people, you have to make decisions for them. They because they don't know any better. That kind of thing uh, also applies to a lot of different groups, but especially for young people. Uh, you been paying attention and seeing what young people are doing around, especially Africa. The only people who are standing up against dictatorships, bad policies, Madagascar, in Kenya, in Tanzania, a country that's never had a major shake-up politically, it's the young people. There's no 60-year-old who is going out there to say this is right. 18-year-olds. So within amongst us, excluding me, um, the key to the future of beyond universal health coverage is with you. And so that's why it's very important that we start to engage with one another, figure out how we can mobilize to make a better place for everybody. This discussion today is about that, but it is also about learning from you. It's not about us coming here and telling you what to do. So toward the end, we spend time really thinking, talking about what needs to change. What do we need to see? What can we present tomorrow, the next day, to the people that are responsible for fixing these problems? Okay, let's look at the agenda now. All right, so we've had the welcome remarks, opening remarks from Sibo. I mean, again, I forgot to really thank the youth platform for um, the way you have brought us into this important work of young people, building the voices and raising the voice of young people. Within UHC, we have some people, groups we work with at the global level, but not at the regional country level. This is the group that is most organized that we have. And we have also seen you guys show up in our UHC Day meeting last week, and all of this really trying to figure out what you can do in your state influence. So thank you, the Youth Platform, for providing this space for us, for inviting us, for being a friend and a partner in advancing the needs of young people, especially for health, but also economics, every angle of it. Thank you. So we're going to have some quick introductions about universal health coverage. It's something that we think everybody thinks knows, and yes, do know what it means. But, it has some nuance to it. So we'll walk you through that. And it's always good to hear about who did it, because sometimes we hear ideas, but you wonder, like, is this really doable? And so we can look at some of the country examples as well. We will then look at social participation. This is the piece around engagement of young people. We don't have much time, so we won't get into all the nitty gritty of how you advocate and all of that, but we will walk you through what this is, what has been done around this, how do we get it to work for you here in Zambia and the countries in the region. Some of you are represented here. And then we will have group breakouts so that, um, you can exchange ideas and learn from each other and teach us something new that we don't know. And then after that, we will have to work on developing something collective set of tasks that we can present tomorrow throughout the conference about what we want to see, what you want to see as young people uh, acted upon by your leaders, and also leveraging the upcoming universal health coverage day, the campaign that we have ongoing now, to amplify your voices. That's the agenda for today. If there's any questions, any suggestions before we begin, is 1 minute, you can raise your hand. All right. I don't see any hands or see anybody, so I will take it as a no. Let's roll the tape. Okay. So objectives. Really, the main objective is strengthening your capacity to advocate for UHC. We don't engage for the sake of engaging. We engage for to achieve something. In this case, we will engage. The engagement, your engagement is for achieving universal health coverage and health for all. That's why you're going to be engaging. And the objectives for today is to you guys really gain a better understanding of universal health coverage and why it's important, strengthening your understanding of social participation and why it's important in the context of strengthening universal health coverage. We will have, as we said, skills building, capacity building. We'll look at what are those we can do within our power. And then we will look at some resources that can be helpful to you. And I want to make sure that, when you live here, you know each other, feel like you can support each other because we're always stronger together. Next. All right. So I'm going to run you through really quick run through a few slides before I invite my colleague Laura to take us through um, the rest of some of the other slides. I do realize that we when I introduced myself, when I came here, I didn't properly introduce myself. So this is my opportunity to introduce myself. My name is Waiswani Kwanga, and I work for. This is going to be confusing. Management Sciences for Health. Now, Management Sciences for Health is not what you're seeing there. Today, I'm representing UHC 2030 and the civil society engagement mechanism for UHC 2030. So what's the difference? UHC 2030 is a WHO, World Health Organization entity office that coordinates all global work around universal health coverage. They work with governments, they work with decision makers, they work with civil society, they work with different actors to make sure that the agenda to give access to health services to everybody does not lose interest and commit political commitment. So that's the office in Geneva. We work with that management services for health. So UHC 2030 is a global movement to build strong health systems for universal health coverage with partners from all over the world. As I said, government, civil society, young people, everybody is part of this movement, of this global platform. We, the civil society engagement mechanism, we represent you in this global platform. And we're not very big, but we are about 100, 1,000, 1,600 members globally in over 130 countries. All the time. Let's look at what really UHC is according to the WHO itself.
Think about it. What do you need to get and stay healthy? Can you get help from a well-trained health worker? Can you get treatment that and is safe? Can you get the other health products you need? Who will pay for it? Are there policies in place to ensure the services you need are available to you, your family, and your community next time and every time? Does your government have accurate information about the whole system so they can make the right decisions to keep everything working the way it should? Good health needs people, services, products, policies, information, and it needs to work together even in times of crisis. And good health systems don't just treat sick people, they to promote healthy living and prevent people from falling ill in the first place. The World Health Organization is working around the world so that all people and communities receive the quality services they need and are protected from health threats without suffering from financial hardship. That's what we call universal health coverage. So here's to health for you and for everyone.
So yeah, it is not just about services, it is also about uh, spending. Who is spending? You know, people may have access to things, but if they're having to sell the only property they have in order to pay for health, we have to look at that. It is also about who is not getting it. You know, you can say it's available, it's free, but maybe there's somebody who is facing stigma and will is not able to go and ask for the treatment that they need because of stigma. So we have to address all of these things. It's not just about here is what you want, what you need. It's also about understanding the barriers that prevent people, even when services are available, from accessing those services. We have another clip to play before. Okay, so why is this important? Let's hear from them, the WHO.
The head of the World Health Organization called it the single most powerful concept that public health has to offer. A solution that can stop the world's biggest killers, from HIV, TB, and malaria to cancer and heart disease. It can help advance gender equality, build resilience to threats like climate change and disease outbreaks, and put us on the path to ending poverty. Health for all, also known as universal health coverage, may be the key to sustainable development. How? First, it's about keeping everyone as healthy as possible. Health is a human right, at least it should be. With proven, affordable tools to save lives, we have the opportunity to make the poor as healthy as the rich. But too many people are still waiting for access to essential health services. Universal health coverage is also about protecting people from poverty. Health services don't grow on trees. The problem is, the people who need them most are often the least able to pay. Every year, almost 1 in 5 people in low and middle income countries are pushed or pushed further into poverty paying for health. Imagine choosing between buying medicine and feeding your family, staying healthy or staying out of bankruptcy. It's the vicious cycle that makes it impossible for the poorest to get ahead and holds entire societies back. By ensuring both good health and financial stability, universal health coverage opens doors for all people to reach their full potential. When everyone is healthy enough to go to school or work and has the ability to invest in their futures, families are better off, communities are stronger, and countries are more resilient. Don't just take my word for it. Hundreds of leading economists call universal health coverage one of the best investments a country can make. So if we know that it's right and smart, the real question is, what are we waiting for? It's time to deliver on the promise of health for all, because it's right, smart, and overdue.
Correct. So you can see it's not just about health, it's also an engine of economic growth. If you have malaria, most likely it's not going to kill you. It's going to prevent you from going to work that day. And that has ripple effects over time. It reduces your income. And so, really, when we make sure everybody's healthy, we're also making sure that everybody's contributing to the development of the country. So that's why this is really important, among other reasons. Next slide. Okay, so here's the definition of universal coverage by the World Health Organization. Universal health coverage is defined as the aspiration that all people and communities can use the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of those services does not expose them to financial hardship. So it's not about only medicine. It is also about preventing getting sick. It's also about promoting health, good health, eating well, exercising. It is also about rehabilitation and all of these other things that you need to be healthy. The medical needs, immunizations are just one aspect of staying healthy. A lot of it is about us promoting behaviors that will keep us healthy. It's about preventing ourselves from engaging in the behaviors will make us sick. So, but even when you do things, the most critical piece is you are not having to make sacrifices, major essential sacrifices to get those things. So that's the financial hardship aspect of that. That's why it's very important when we define UHC. Next, please. All right. So where does this come from? This comes from the Sustainable Development Goals. This goal number 3 over there, UHC, universal health coverage, falls under the goal of health and well-being, number 3. And it really makes the dots between education, about economy and poverty and all of that, and UHC. Next. I think this is self-explanatory. Let's keep going. Okay, so that's for you to get a sense of what we are talking about. Universal coverage is really about that. It is not very, it's not rocket science. and don't let anybody, the doctor, a scientist, some educated person come and tell you you don't know what you're talking about. You know what you're talking about. We all have sick people, have non-sick people, we've been sick. We know what health really is. So it is basically that. But what we want to hear from you now is why you really were interested in being part of this workshop. Let's call it a workshop. What interests you in this? It can be your personal experience, can be something you read about or you know about, a feeling, just to get to hear from you as well why this appealed to you. Okay? All right.
Sorry, I didn't see your hands. I see 1, 2, 3 over there. 4. Great. Let's start with this 4 first.
Okay, morning, guys. Okay, so for me personally, I think the concept of universal health coverage that pushed me to want to participate is the issue to do with meaningful youth participation, which goes beyond just general consultations. So in Zimbabwe, we do what they call every time before they pass bills, they consult the youth, and then we go to the parliament. We have the full parliamentary experience, and we give our personal opinion. But most times, it's a box ticking exercise just to say, we had the youth there and they said this, but it never does any meaningful change. So it's to push the youth to want to actively participate. So this is mostly done through CSOs and other platforms. So I think this is a great experience because for me, it's going to give me the right tools that I need to implement the communal change that I want to see. Yeah, thank you.
Thank you. This is also what we call a lot like tokenistic representation. So that's a great point. Thank you.
Good morning, everyone. Okay, I'll just stand. My name is Annette, and I attended the Universal Health Coverage last year. So it was a platform for me to understand more about advocacy when it comes to universal health coverage, what is in universal health coverage. And what has motivated me to attend again this year is to get to understand what type of policies are aligned with universal health coverage. Many other times as young people would want to advocate for universal health coverage, good health and well-being, but which policies are we aligning ourselves to? If we're going to hold duty bearers accountable, we need to have full information on which components does health fall in. So if we have 5 policies, what do those 5 policies say, and what element of universal health coverage is in those policies? I think that's one thing that will help us when it comes to advocating. Thank you.
Thank you, Annette. So how do we hold accountable our governments and our leaders about the commitment on UHC, right? Yes, over there.
Thank you so much for, my name is Mwene Brian, and what interests me to attend this year's workshop on universal health coverage, apart from my personal interest and passion for universal health coverage, is also the type of community that I serve. Where I work in a community, in a rural setup where I see realities, those challenges that people face, even accessing simple services such as family planning. A lot of young people are getting pregnant because they can't access family planning. Others are asked to buy family planning. So it's a situation where they have to choose. Should I buy school shoes, or should I buy family planning? And they're put in a roller coaster of thoughts to say, which one do I go for? And at the end of the day, they make those poor decisions and end up maybe getting pregnant, which will have a lasting life impact, negative impact on their lives. So this really speaks to me. And the fact that today we're talking about social participation, I think it drives the conversation from just being consulted to actual influencers of policy, of decisions that the government makes. I think that speaks to me, Rola. Thank you.
Thank you. Great speeches. And it's actually really linked also to the UHC Day theme this year on health cost hurt and accessing and that no one should ever have to choose between food, housing, and health. So let's come to that in a minute. Thank you. Yes.
Thank you. My name is Asford Jimugajonya, and just like my brother here, I come from a rural area, and universal health coverage cannot be discussed without us discussing the rural areas. And these are the communities that are marginalized. And you're going to realize that the struggle is really real. People are failing to supply or indeed meet their daily needs as regards to food in health, in terms of uh, medicines and other essentials. These people are failing to access them. And so if we are discussing universal health coverage, we should be able to sit down and analyze the areas that are marginalized. And rural areas are struggling, rather struggling in that area of universal health coverage. And so as advocates, I think it is high time that we availed ourselves and went into the rural communities to ensure that these people get the much desired needs as regards to medicines and essential supplies for their daily livelihoods. Thank you.
Thank you. Thank you for your patience and your energy. Wow, I see a lot more hands now. Maybe let's go through a few more. Two more. I know you had your hands up, and then we'll see.
Good morning. My name is Pageo Pineo Katongo, coming from the University of Zambia. So I am a researcher, by the way. So my motivation basically is to look at the policy gaps where adolescent is concerned, because a number of the times I've realized that the policies which we have does not necessarily address the adolescent challenges which they're facing when it comes to health. So I want to, I'm motivated that we're going to reach at a point where we're going to delve into these policy challenges, and maybe at the end of the day, I can come up with an article and maybe submit it to relevant authorities. Thank you.
Thank you. That would be very, very great. Okay, we have room for one. Okay, let's take maybe the two more. Yeah.
Thank you very much. My name is Blessing Walia. I'm a student at the University of Zambia. What motivated me to participate in the workshop this year? This is my first time participating in this workshop. I'm just curious around what the universal health coverage looks like for individuals, how it captures the unique lived experiences of the current generation, and how progress is tracked, since one of the failures in advocacy space is that there's segmentation of reporting. So how comprehensive progress is tracked from all the organizations, and how we avoid replication. How does the universal health coverage look like on paper, and how does it look like for mere people that are experiencing different health challenges? Thank you.
Okay, my name is Moses Soko. I am deaf. I'm a director for Zambia Deaf Society. And what motivated me to come here is to learn about the UHC and how my brothers and sisters who are deaf and other disabilities can access health care services in the future. At the same time, I want to learn more because I was born in a shanty compound where I have witnessed poor people and persons with disabilities struggling to access healthcare services. Many people die out of funny diseases which can be cured, which can easily be cured, but you see them dying. Now, from here, I believe that I will be able to get some knowledge, can at least partner with the different organizations and decision makers so that we can simplify on the care services for persons with disabilities. Thank you.
Thanks, everyone. Really important questions or comments. Where do I start? So there's some themes here on meaningful engagement on the rural communities, on policies, on reporting, and also just learning on how to um, uh, represent, make sure that the needs of certain communities, like people living with disabilities, can also be addressed. So that's kind of the buckets that I put questions in. So on meaningful engagement, um, so this is a process. Meaningful engagement is a process, and I hope that today will be the first step to us looking at what exists and how we can influence. And act like they have listened to you, but there's no follow up or follow through. This is not something that only you are facing. We face this at a global level. Like we are talking about mm, heads of states, presidents, ministers sitting there, always making sure that there is somebody from civil society, somebody from the young people community, somebody with an experience of personally being impacted by a health problem, and they sit there and they watch and they listen and they pretend like they're paying attention, but the moment the cameras are off, they don't do anything. And they even lie about the data of how amazing they're doing when they're not doing the things from the perspective of the people that are living in the communities. So this is a big frustration, but it's not a reason to give up. I think advocacy is not something we do for a couple years, for 5 years, and expect the results all the time. It really requires a lot of patience, a lot of hard work, coming back and not taking no for an answer over and over again. The moment you give up, they want even the little space you had, they will take it. Meaning they will, even the little services they were giving to your community, they won't give it and more. Because there's nobody pushing them. So it is a frustrating thing. I understand, but we are here to work with each other to make sure that we can change this. On the rural area communities, I come from a rural community myself. I know exactly what happens there. Unfortunately, regardless of all of us, including our presidents, come from rural communities. Most of African presidents come from poor backgrounds. They become presidents and they change. So it's always the rural communities that are neglected. It is always the people with disabilities that are neglected. The promise of UHC is for us to make sure that people and rural communities and people with disabilities are not neglected. We will scream, we will talk, we will do everything to make sure we raise the voice. And it's only if we sustain that that we can make the difference for those communities. It is something we have to do and be intentional about doing for a long time. They're not going to change tomorrow, but it is possible. We've seen it in other countries, in Brazil, in Thailand, in we're talking about, I think, Cambodia. Cambodia is a very poor country, actually. We're seeing it even in Africa. Governments start to respond. So there is hope, and we have to keep pushing. On the question of policies that don't address adolescent issues and policies, two or three policies that needs change. There are many policies, and this is the part of the problem we have. There's so many policy, prescriptions that have been put out there by different people. And it's sometimes really challenging to figure out what are those two things that you need to do. It doesn't have to be very complex and complicated, but that's how bureaucracies work. They take simple ideas and make it so complicated and complex. We need to figure out in Zambia, in your community, what are the three things that you want the government to do to make a difference? That, don't come up with 5 asks. You want the government to come up with a lot of things. So the approach is to always figure out those 3 simple things that can be done. Start with the simple ones, where the leader is going to be like, wait a minute, me to give water, access to water for this community. Like, that's something that we need to do. Then they don't act. So we start with the simple things. Then over time, we ask for more advanced things. On reporting on UHC, or addressing challenges of adolescent people. So, I mean, family planning, things that we should have in every country, free family planning measures. I mean, we get upset about these things because it doesn't make sense. In the United States, a morning after pill, a morning after, is it called morning after pill? Is that what it's called, right? Is $50. And they did it intentionally. This is a country, the richest country, but they did it intentionally because of the Christians. So you have, I know we're a Christian country, I hope here too, I think. But Christianity has always had a certain element of evil to it, of power, wanting power, all religions wanting power. And so they do things that are not in the best interest of people, but they are in the best interest of their own beliefs and wanting to control people. $50, even for an American, is a lot of money to spend on something as simple as that. Somebody gets a baby, they can't feed them. There's nowhere, even in the United States, where you can take a child and get free food. So this is the kind of thing. This is a government can do this, where family planning is available to everybody everywhere. We used to have it through USAID in developing countries. We used to have it through different programs, including, maybe, I don't know if the Global Fund does it. I don't know, but they're cutting all of that because the Christians in the United States have taken over. You might say, yeah, but you will die. Somebody will die even if you believe in Jesus Christ. There's still somebody that needs to eat. There's still somebody that needs treatment, regardless of Jesus Christ. We still need people to live healthy lives. So they have cut all of that, and it's going to get worse than it's been so far. So I understand your point. It's really challenging. We have to keep pushing our governments to do more. On reporting, we do have reporting at the global level. The Global Monitoring Report, who asked that question, I think, raise your hand. At the global level, we have a lot of reporting, but reporting is useless. There's a lot of reports, this report, that report. Even this country produces one for universal health coverage, but it is useless when it's all about, oh yeah, this we found ABCDXYZ, and they make recommendations that they put on their shelves in their offices, like decorations. This is why advocacy then is important, because we take that and we say, out of this, we're going to take 2 things and we're going to fight for those things. And we go and fight for those things where we can, we're able to win and make some changes. So it is, but the data is there. You need the data for sure. It is there. You just need to figure out how to use it to influence what you want to influence. Disability and learning, the communities of people living with disabilities, different kinds of disabilities, are always the ones that get this in, I don't know if this is an expression in local language here, the short end of the stick. Meaning, I mean, it's like things that as human beings, we should by this time know that nobody wakes up in the morning and says, I want to have a disability of this or of that sort. And yet, we have a world in which we look at people with disabilities as less than, as undeserving, as almost stupid. I have uh, a niece who has a disability, is deaf, and all of that. And I've seen her grow up, and she's been abandoned alongside her siblings. The education is not there. She stopped at like a few classes and there wasn't service for her. And so that kind of, you leave this young woman who has a full brain, all the potential, and the society looks the other way, including the family members look the other way. So yes, there's a lot to learn and there's a lot to push together for to better improve the lives of people with disability and their voices, especially the voice. In the United States, in the nations, I'll give you an example. This is how bad it is. They have this beautiful, some have been there, beautiful UN building, and they have interpreted different languages, Arabic, whatever. They have nothing for people who need sign language interpretation. United Nations, the think we'll look out for you and we'll have this to do something like that. They don't. They also have halls where they invite us to go and we go, but people with disabilities, like in wheelchair, cannot get in. We've had ministers with disabilities being locked outside of rooms of halls because there's no way to get them to the floor where in the spot where they're supposed to be. This is how backward the world is. I come in here and I the building. This is only in Zambia. I don't see it anywhere else. Not even in the international institutions. So we have a lot of work to do, and we can do it together. Sorry, we taking a lot of time, but I hope that this is a really helpful exercise for us to hear each other, bounce ideas, and also it's kind of like great to know that you're not alone. Everybody else is seeing the problem, and they're with you. So thank you for your questions and your comments. Let's keep working together. So Laura, what comes next? All right, this is for you. So Laura will take us through the next part, and then we'll take a quick break after that. And I don't know what time it is. We'll also have lunch at some point. Oh, we still have time. Yeah, yeah.
Thank you all for the great participation already so far. So I'm Laura Philidor, and I work very closely with my colleague Waiswa here. So also representing CSEM today with you all. And I work for also another organization. So Waiswa works from Management Science for Health, and I work for Waki Health, which some of you might know. They're an African-based NGO based in Kenya, South Africa, and Ethiopia. And they also work on UHC, but on a lot of different other subjects like sexual and reproductive health, HIV, malaria. They're lots engaged into the global replenishment, if you ever heard also about this. So yeah, also like to say hi to Robinson, very closely with at Waki. So thank you for all of you and for the team for providing the live and the recording of this session and for all the pictures. And again, thank you so much, Sibu, and all the TYP team for the huge support, for the great invitation. We're so glad to have the opportunity to do this with you today and to be here over the next 2-3 days. So, right, let's jump also right in. So we're going to talk a bit more about social participation for health and UHC. So the term of social participation is a bit peculiar, but this is basically what we've been talking all along during this session. Social participation is about meaningful involvement of civil society across the policy cycle and at all levels of the health system. So wait, what does it mean? This means that this term refers to involving civil society, but also young people in health decision-making processes. It means We don't call on young people and civil society at the end to validate what has been done so far. Like our dear friends, I think Yemurai was mentioning at the start, it means that people and civil society are called from the start, from deciding which kind of decision has to be made, who should be involved, what will be the step, and also to be able to provide the voices to the actual decision-making process. So the definition you see in blue here is the official WHO definition. So let's just read it quickly. Social participation in health refers to the meaningful involvement of people and civil society in decision-making across the entire cycle and at whole level of the health system. I think it's pretty close to what I said, so I must have learned my lesson pretty well. So why this is important for UHC? What is the link with that? So, UHC, we had a question on what UHC look concretely for people in daily life. That means you have to, think about three main things. Do you have access if you're sick or if you need prevention or treatment? Do you have access to medical doctors? And do you have access to the health services you need in your country? That one. Two, is it affordable? Right? If you have access to it in your country, but you have to pay thousands of dollar, kwashwa, or anything else to get it, and you can't afford it, well, it's useless, right? The third one is it accessible to everyone? Would you be denied of accessing health services because of your religion, because of your sexual orientation, because of a specific disability, because of a stigma? You might know also that HIV was a disease a lot stigmatized, for instance, and a lot of people didn't get access to treatment and services they need because of the stigma around the disease. Everyone was scared because they didn't have the information about it. So that's how UHC look, and most of the country don't have UHC yet. So now coming back to social participation, it means that we need the involvement of you, young people, and marginalized one to make UHC a reality. It's important because if we put people at the center, that means that the decision that will be taken at the global, the national, the regional, the district level are relevant to people's needs. Second, it means that it will help strengthen health system and health equity, because regular dialogue between governments mean that there will be, a large group of people and diverse voice. That's very important. If you have a group of civil society that is only chosen by the government and is very homogeneous, then you miss the point, because you don't get the voice from the people from the rural areas, or for people with disabilities, or for women, or from young people overall, for instance. And then, very important points, it's fostering trust in health system. So sometimes we see barriers in, making progress towards UHC because people, civil society, young people don't trust the government in charge of making those decisions. And it's true, right? Why will we trust them if they don't listen to us, if they don't listen to youth voices? So that's very important, because if they apply and implement social participation, well, trust is in the balance again. Next slide, please. Yeah, Waiswa, do you want to? Yeah.
So on the point of trust, this is really key. This is really key because without trust we saw this with COVID, in the system, the health systems means that people are going to decide not to seek the care they need until either they are very sick and it's very costly for them, or they cannot be treated to recover, or that they make somebody else sick. And so, because they're afraid, or they don't believe that the healthcare system that exists is for them, or that it is, there's all these conspiracies about like immunizations, like, if you take this vaccine or that vaccine, you're gonna die. They're trying to destroy. This is, again, I'm sorry to say this again because I'm a Christian. This is now very common among Christians in some countries, in the developed countries, that are spreading these rumors around basic things. When I was growing up, we used to have polio, a lot of polio. We used to also have leprosy. I don't know, has anybody seen leprosy? Somebody with leprosy? Where like, your hands, or like, it's just, it's something you don't want to see somebody go through. Vaccines change these things. We don't even have to worry about being born unable to walk or things like that anymore. And it was because of vaccines. Yes, there will be mistakes where vaccines don't work perfectly, but what works perfectly? Even God doesn't, because we wouldn't be here dealing with our issues if God did. And so nothing works perfectly, and we need to make sure that we trust each other and work together, talk to each other to shape the health systems that we need. Thank you.
Thanks, Oeswa. That's a great point. Now we're gonna look at a video from WHO to understand better social participation.
We have never been so aware of government actions to protect our health and well-being. Yet, too often, people's insights and lived experiences remain unheard in government decision-making. Governments must make a targeted effort to change this. Amplifying people's voices in health policy making by using participatory spaces as part of decision-making processes is the way forward. If these spaces are well designed and used regularly, they have a transformative potential to become a potent tool for more responsive and implementable policies. There are many ways governments can engage with the population to catch their needs. Mechanisms such as open forums, citizen juries, consultative meetings, and district health committees with fixed seats for civic and community groups are all methods of engagement. But government resources and capacities are too often lacking to manage these spaces effectively. The WHO Handbook on Social Participation for UHC provides practical guidance for policymakers to engage with the population by creating, strengthening, and sustaining participatory spaces. Policymakers must learn how to design spaces to empower people to express themselves frankly. Several examples drawn from countries' experiences are laid out in the handbook on how to do this. For example, define clear criteria to select participants. Be explicit about goals and the added value each participant brings to the policy question. Communicate goals and mandates transparently to all participants. Transparent communication lends legitimacy to each participant and values inputs equally. This is especially crucial for community and civil society groups. More influential stakeholders, such as academia, medical doctors, and government actors, derive legitimacy from their professional positions or standing in society. Therefore, a targeted effort is needed to lend legitimacy to those whose voices are generally less heard. It's time to invest in social participation. It's time to move towards regular and systematic public and civil society engagement for health decision-making. It's time to build a health system that belongs to the people and responds to people's needs when no one is left behind.
Good. So what we see in this video is a bit more detail on what we were saying. The first point is that there is many ways to engage civil society and young people in decision-making processes. So, what works in other countries, for instance, in Thailand, where social participation is institutionalized, will not work, for instance, in other countries. How do you choose to be engaged as young people or civil society? Is it via forum? Is it via specific and regular meetings? Is it via a jury? And sometimes you even constricted because your country, Zambia and other country in Africa, might already have decided that. So at this point, how do we know how to get involved, and how do we, map out these spaces and ask for more? This will be part of our activity this afternoon in breakout room. So looking forward to that. So that's one point. The other also very important in addition to this is that government has to fill up some criteria to make social participation relevant. They have to be transparent with us, transparent about how they select people that will be in decision-making processes to make sure this is really, really diverse. We had this issue, or this concern when we part of a group in social participation. I will talk a bit more about that because it's linked to this big decision. And in this group, we were working with governments who wanted to involve civil society, which is great. But we weren't sure how they will be selecting people from civil society who will take this decision. A major barrier, because if the governments only choose people who are already agreeing with what they're doing, then we lose the power. So let's move to the good news now. We've seen the term on social participation. The good news is that we can say that every government committed to institutionalize social participation, because last year at the World Health Assembly in Geneva, the resolution on social participation for universal health coverage, health, and well-being was adopted by the UN member states. What you can see in there is like a few countries, Slovenia, Thailand, Brazil, France, Norway, and Tunisia, who led this negotiation. It's a huge process to adopt these resolutions. It goes often for like a few months or years. It involved negotiation between member states to agree on the text, involvement of civil society to input what will be on this resolution as much as we can, because this is not always easy. So we've also been involved as CSEM and other civil society a while for advocating for the adoption of the resolution. And even before that, you have to advocate really, really hard to say to member state, this is a priority and this has to be adopted. So that's a huge win that we can celebrate, because this means they recognize to ensure accountability and legitimacy of health system strengthening and UHC efforts anchored in a primary healthcare approach. So now that this resolution has been, let's zoom a bit more on what they committed to do. So then we can hold our governance accountable. So let's start. First, they want to strengthen public sector's capacities. Then enable equitable, diverse, and inclusive participation. That's what we were saying. Make sure that in this group, it's quite diverse, coming from different areas, different specificities, with a lot or not information at all on health system, with lived experience also. That's a crucial point. Then influence, striving to ensure that social participation influence transparent decision-making for health across the policy cycle at all levels of the system. Transparency and accountability are key. We want them to inform us how they are making this possible and the results of social participation and inclusion of youth and civil society. Implementing and sustaining regular and transparent social participation using a range of mechanisms supported by public policy and legislation. How will they put that in place? Do they choose to have an assembly? Do they choose to have informal gathering? A decision has to be made and we have to be informed of that. And we have a on this and how we want to. 5, allocate and sustainable public sector resources in support of effective social participation. What does this mean? This means that, we have to support people to participate to this mechanism. Sometimes it's about transport. We want to have people in a certain area, but you have to finance them to come and go to this meeting. Sometimes it's about accessibility, interpretation, for instance, to make sure that everyone has access to the information. Then facilitating capacity strengthening for civil society. So having people from a diverse backgrounds and make sure they have all the information that they need to participate to these decision-making processes. Sometimes it's huge, it's different from each and every country. We don't have the information that's the same for every country, so it's also important, to be involved and have information that you need. What is at stake? How does it work in your specific country? That is something that should be provided by government to make sure it's relevant. And then the last one, supporting related research and piloting projects, program, and then monitoring and evaluation to promote implementation of social participation. What does this mean? That means that along this process, we keep on researching for the best way to go, we keep documenting, and we make sure that there is a monitoring and evaluation process. It will not be perfect the first time, it will not be perfect the second time or the 100th time, but the aim is that these processes and involvement keep improving to make this a reality. There is a lot more in this resolution. I think it's 10 pages in total. So, we invite you to go also and have a look at it, but that's the main point that we wanted to highlight. Great. So now what is our role in advocating for social participation for UHC? Now that this resolution has been adopted, so let's recap. We are advocating for the resolution, now it's adopted, and it doesn't end there. We have to make sure it's implementing, institutionalize, which means that, you have to adapt the resolution to each country. But you sure that your government is actually, moving from commitment to action. So that's a good point. When you're going to see like your member of parliaments, your ministers tomorrow, and we're going to talk about involvement of young people, you can say, hey, you've committed to institutionalize social participation. What are you doing about it? How can we be part of this discussion? So at the global level, we have a campaign to make sure that this commitment translates into like actual policies, actual laws, actual legislation, to make sure that youth voices and civil society engagement is strengthened. So all this, I said implementing, but you will hear a lot of the term institutionalizing social participation. That's the key word. Target audience. And also happy to hear more about you here. Like our target audience for this campaign are like national and local governments, like Ministry of Health, Ministry of Finance, Member of Parliaments, your local and subnational authorities. But I would like to hear more here. You have ideas coming up. Also like, yes, really, really local decision makers that could make a difference. So open to hear more about that. And then what is our role, our youth and civil society? So first, raise awareness. Sometimes a lot of decisions are so your decision makers and political leaders are not often well aware of everything going on. So just reminding them, this resolution has been adopted. You committed. So what are we doing now? Few tools, we'll come to that just after, to engage decision makers. We have letters, we have a lot of information in there, we have all the tools, so we can discuss more. And then, once you met them and raise this to them, hold them accountable, follow up with them, make sure that they're actually doing a thing. What I was rightly mentioning, time is frustrating. Like you see your member of parliaments, your ministers, or any other local decision makers, and we're facing that too. And you say, yes, okay, we agree or something, and then nothing come out from the discussion. So how do we make sure this happens? Let's move to the advocacy toolkit on social participation. But before that, because we're going to close this session with this, I just want to hear a bit more from you here in the room on, the target audience. Do you think about any other people we should be targeting in Zambia or in other countries in Africa? Yeah. Yes. And also like any question about social participation or like, comments to see if you can see that maybe in the work you're already doing, or like Any comments, any question? The floor is open.
Okay, see hands. 1, 2. Okay, 3, 4. Okay, great. All right, we'll start from the back. All right, thank you. Right. I just want to respond on who do we think can also be added on the target audience. I don't know in other countries, but in Zimbabwe, we actually have the traditional leaders. I think they're quite key because they're the gatekeepers and they've got access to some of the areas. So I wouldn't know in other countries, but I think the traditional leaders, as well as the faith-based organizations, because faith tends to also bring down all the efforts that you're doing. But if they included the churches as well, I think this advocate can be this advocacy to drive implementation can be successful.
Thank you very much. I begin by responding to the first question. How do we feel after hearing about social health? I think it's something that I'm seeing in the work that we're doing as organizations. However, there is a very huge gap, especially when it comes to inclusion. I understand that we talk about inclusion in all the meetings that we attend, and most of the that has been around disabilities, people live, but no one is ever talking about people that can't articulate their own issues but understand their problems. And so when we talk about inclusion, I think it's something that we can improve on. We can also just start to discuss around those people that have issues, they have problems, they understand their problems, but can't articulate them the way we articulate them in these meetings. That is inclusion in social participation. And I think it's more meaningful if the person that is experiencing the challenge is the one that is one explain it in the best way that they can. And then who can we bring to the table? Who can we engage in advocacy? We have the Parliamentary Youth Caucus in Zambia that we do not see working. I think we can start by identifying them and identifying with them. It's easier to get policies to pass into parliament and to influence policy change if there's already a legal existing body of young people that are working towards the same but seem to be unfunctional. We can also include the parents, because even after we ensure that these policies are passed into law, young people are still going back to homes. They don't stay on their own. They still have someone that they have to go and confirm with and ask for permission before they get access to any of these healthcare services and commodities. Thank you.
More hands. 1, 2, 3. Okay.
All right, thank you for the opportunity. My name is Alexa. I'm from Zimbabwe. I actually wanted to mention what my two other colleagues mentioned, how we should target the chiefs, the local leadership systems, but also just to add on, I feel like it's beyond target audience, but also the message that you're sending to them. Because for example, you said Ministry of Health, Ministry of Finance, you can't use the same messaging you're going with to the Ministry of Health and use it to the Ministry of Finance. So if we're dealing with the chief, let's talk to the chief in a way where we're saying this will benefit you in this way. If we're going to the Minister of Finance, this is going to help you reduce costs in this section, or it's going to help you in your budget in this area. We can't go to him talking about health because he's worried about money. So it's beyond the target audience, but it's also about what message are you sending to that audience.
Okay, hi guys. So I would want to circle back to what the second speaker said. She talked about how it's important to have the information going to the right people, if I'm correct. So I think it's also an issue of we can't have youth actively participate or people in rural areas actively participate if the information doesn't reach them. We have an issue of probably sending pamphlets and emails that are written in English to people who only understand English and certain other languages. We don't have this information in Braille. We don't have this information in localized languages, and we don't have even advocates going into the communities that we want to implement change, talking about it, so we have active participation from the community and not just representatives who are probably staying in town but hearing about a problem that exists in a rural area.
Hello, everyone. So I would like to talk about youth and civil society advocacy. Many of the times when we are trying to do our campaigns or awareness strategies, we do not really tailor information, just like the previous speaker said, to tailor the information relating to the people we're approaching. And one other thing that works very well is to raise awareness based on platforms that have more influence. Example given, I come from a sports organization. I work in sports, but I am a public health nurse by profession. So I'm doing health and well-being in sports. So I feel like when we look at also platforms of advocacy, we should use platforms that always grab a larger attention, which is something like sports. So we can see how we can tailor messages around advocacy in sports, advocacy in health facilities. The people that we can also highly engage, the way we have the Ministry of Health, are the people that are working in health. They understand issues of universal health coverage better. So if we have health practitioners that are relating to universal health coverage, understanding these key issues and them getting to interpret them in their own ways to also communicate to the communities. So in the areas of advocacy and raising awareness, we need to use different platforms and different strategies. We shouldn't use the same strategies we've been using all this while when we want to tell our information. What language are we putting in our campaigns for universal health coverage? So that also has to be something that has to be looked upon. Thank you.
Thank you.
Thank you so much. So many great remarks, and I feel that you're already very familiar with social participation. Maybe the term was not there, and maybe it's more about the resolution. But I feel that the work you're already doing, or the way you're speaking about it right now, is like we already have experts on advocating for inclusion of civil society and young people in the room. So thank you so much. First, maybe responding a bit to Elliot, thank you for adding on this target audience. This is exactly what we're looking for, because the audience we have here is like target audience for the global level and what we kind of agreed in with different countries, but tailoring it specifically to the country context, it's crucial. So very well noted for traditional leaders, local leadership, faith-based organization. And I feel that in the work we will be doing this afternoon, we'll have to keep this in mind, because this is where we will need input, because you know how to address to them. You know what kind of messages they are listening to. We don't. So this is exactly the work and the kind of help we need from you here to have this active group then to implement social participation in UHC. Then thank you also for mentioning, Sabi, the huge gap in inclusion that we're still seeing, especially for people who have, definitely issues in terms of health, but cannot articulate this as we can in this room, because they're lacking information about how to engage, lacking information about what's going on. But to make this decision relevant, we need the experience. That's why we're trying also to collect as many, live experience stories that we can. But to be honest, it's something that we're still lacking a lot. We're still facing barriers, like how do we make sure to reach out to these communities? As CSM, we count on our AG members from different countries. We will be counting on you also to, help us reach out to those people to have their stories in place. And for the government, it's also their responsibilities. When we were talking about capacity strengthening, this is where it comes in place. Normally, they should be able to bring those people on board because they committed to have this kind of, workshop to explain everything, or at least to, keep them informed so they can also articulate. But it's our role as, youth platform, system platform, to raise those voices. So feel free to reach out to us if you have any of those contacts or stories we can share. Then a very important point over here on the tailor messages and the tailor language. So, we have different target audience here. So we also counting a lot on you on how tailor our messages. We have templates. I'll come to that in a minute. We have letter templates that can be used, but where we have to feel exactly the messages we want to convey, depending on the people we are addressing to. So that's really, really crucial. And then we very conscious that, for instance, even this tool, so far we have it only in English. We hope to translate it very soon in other languages. Thanks to one of our AG members, we also have it in Spanish. But same, like if any one of you here is willing to, provide support in translating this tool in your local languages, that will also be great. Yeah.
Something in French, Laura is a French person, so she can always help with that.
Happy to, and you probably already guessed it with my accent. So, and then also very, very looking for one because I have like a comms background. And so when you talk about use different platform and use broad platform beyond health, it was music to my ears. So I know like we are in a strategy this year, for instance, to engage we hope this to be a great, huge youth group for UHC Day. We'll give more information also on that after. I know I said this a lot. But in this youth group, we're also targeting like other youth group that are not part of health. And we're also targeting sports group from the last Olympic Games at the moment. So also like, if you have other groups to that, we'll be really willing to hear about this. Okay, that was a great intervention. And I think we already started the work for this afternoon. So now let's move a bit to the resources that we have. So after the adoption of this resolution, we created a toolkit to gather all this information on social participation. As you saw on the video from a WHO, there is a lot of things. You have these WHO papers they were talking about on social participation. There was a lot of documentation that was created around this for years. So this tool is meant to like gather the information in a concise way. So you can find it in our website via the QR code here, but we also have a quick 2 pages. Some of them have it in the room. We have more. And in these 2 pages, it's like a quick summary of what is social participation, what is the main role of, what is this resolution we're talking about, and what is our role as our civil society to make this happen. So how to use the toolkit? Next slide, please. So the toolkit is built in 5 different sections, and you will find a lot of different information. So we go back to the basic that you're already familiar with from this session and probably from before, but like understanding social participation, so the definition, what it implies, the main criteria for effective social participation in decision making. Then a whole section about the WHO resolution, which details a bit more what's in there, the main commitments. So when you tailor your messages to your local leaders or to other target audience, you can pick also specifically for what they committed to, what was agreed on from this resolution, depending on, the specific focus area. Then we have also a whole section about the role of civil society. We were concised, but there is like kind of 10 main points that are also described more in this tool. We talk about raising awareness with decision makers. We talk about engaging directly with governments, but there is also, mapping existing participation mechanism that we will do today with you. So that will be done on our side. Advocate for legal and policy framework. We're going to see that. Promote inclusive and equitable representation. Happy to hear more about you about who we should think about to be in this group to make sure it's representative, invest in capacity building, and so on. So yes, after that, you have a case studies and example. So we're still collecting case studies, by the way. In these case studies, we have specific case studies of countries where social participation is institutionalized. Again, you can always improve. But for instance, Thailand, they have a national health assembly, which has different steps to collect civil society point of view and inputs before the adoption of any resolution. And they also have transparency and accountability mechanism to go back to people who were involved and inform them or where the decision making processes are. I'm not a specialist of Thailand, but this case studies is very inspirational. We have one from Brazil, and then we have also other case studies just for like specifically on how communities were involved in this, like beyond this being institutionalized, like good example of practical example on how this was made, social participation. So for instance, we have a case studies in Mozambique in which access to health in a hospital in a particular area was like cut off for like a few days, which was very critical. And civil society gathered to like form and train with the help of the government specific, so nurses and other civil society who could assist in making the continuation of health for a while. So this, it would be really, really better detail in the case study there. And then for practical tools, so we have a letter that we will work from to draft our messages. And we'll have also like a mapping of specific opportunities at the global level, but also national level in there, and a specific sheet with like key messages for social participation. I'll stop here. I hope this has been helpful so far. We have a few more of this, so I can distribute that a bit also. But maybe if you have access to Wi-Fi, like don't stay to scan the QR code there and like save this link for later, so you also have this information. And yeah.
Just to add on these concepts like resolutions, declarations, agreements, and treaties, and you hear these things said all the time. And it's confusing, it's intimidating even to me. I'm like, like, what am I supposed to do with that? So resolutions and declarations are the ones that you hear us talk about the most, but they are not legally binding documents. These are like negotiations to say, okay, man, we come together, we agreed on this, we agreed on that as member states means governments that form the United Nations or the WHO. So we agreed on this, we agreed on that, but you can't sue them. You can't, if they don't deliver, you can't sue them, you can't hold them accountable that way. Same thing with the resolution. They come together and they write a resolution. You hear about resolutions on Gaza all the time. Every day they're passing resolutions, but Gaza keeps going on because these documents are not legally binding, even when all member states agree on it. Treaties are legally binding. If they violate it, even you can walk into a court that has the jurisdiction and sue a government or sue a number of governments. So we don't have that. What that means for us is actually is a good thing because sometimes when you have laws, governments will deal with you in legal way. They don't want to deal with you outside of that. So having it not legally binding means that we can go to them and talk to each other as equals about what's in these documents and what can be done without them feeling like we're intimidating them. They're in trouble, they're scared, because they actually get scared. So the point of these resolutions from where we stand, from where you stand, is to use it as a resource to go back to go to government and say, here is what we agreed as a country to do. It helps them understand and remember that they have responsibilities that they have or commitments they have made, they have to meet, even if they're not legally bound. you point to a document like that and they say, we don't want to talk to you. It's not, no, they always understand these are conventions that member states respect. And so they may not necessarily want to act, but they do respect that this was a process that we agreed on as a country. So always go back, not to threaten them, but just remind them that we have this important agenda you agreed on, and we need to really actualize it together. And we're here to help you actualize it. Another term, institutionalize, institutionalize, institutionalize. It makes sense, but also sometimes hard to understand the practical way of it. But what we are saying is a mandate. The mandate for Laura and me today was to do exactly two things: walk you through how to advance our UHC and also social participation. We're not going to talk about it like advancing HIV. We want it through UHC, but that's not our mandate today. It is institutionalized for us to focus on these two things because that's our mandate. Institutionalized just means that they give clear mandate of what is or the process is going to look like. Who does what, when, and where, laid out. I don't need to go to one official, they tell me one thing and another and tells me another thing and all of that. There has to be clear instructions on what, as a country, is going to do, we're going to do to achieve or to advance the resolution on social participation for universal health coverage. There will be other things. There will be maybe for political purposes. We are not talking about that. That's important. But for this is to say, this resolution says you have to do A, B, C, D, X, Y, Z, consulting communities, talking to civil society, to young people especially, to make sure that coverage is available for people, that people are healthy, stay healthy, and live healthy lives and productive lives. So that's what we mean really with institutionalizing. Has nothing to do with, like institution is so big, like the UN is an institution, your Minister of Health is an institution. Then what does this mean? This means process for us to work together to achieve a collective end, which is social engagement of communities in decision making for health and beyond decision making. Because when you make a decision, we're going to do A, B, C, D, X, Y, Z, then there's a process to do it. There's a program to do it. So implementing the program, they are there to say, this is what has to go in this program. And then when it comes to evaluating the program after implementing it, civil society is there to say, okay, that's true. The government says it did A, B, C, D, X, Y, Z, but this is what we see as civil society that was not done or that was done. We're not only here to criticize, we're also here to acknowledge what has been accomplished. So with that, I think, is it time yet for lunch? Because we've talked quite a bit. Is it? What time is it?
So what we can do maybe, because some of the group from Robinson will be gone, we can take a first group picture.
Okay.
Yeah.
So we are very lucky. We're going to round of some photo, take some photos. Is that what it is? Outside or in here somewhere? And then we'll have lunch at 12:30, 12:30 to 1:30. We'll come back here and then dive into the material where you all take charge and
Do we have an idea of where we will take this picture? We'll take it. Is it outside? Yeah. Okay, so we're gonna go outside here. We'll take umbrellas, maybe one of the youth platform banners, and yeah, be ready for the group picture. Okay, I've just been informed we're gonna rather move in front of the hotel. So if I'm not mistaken,